welcome, and many thanks to each of you for taking time out of your busy schedules to join us for this series, Finding Hope and Meaning Through Stories during the COVID-19 pandemic. Why don't we get started today? Helen, what do you think that the pandemic can teach us moving forward overall in healthcare?
What does the pandemic teach us about the future of healthcare? I think it teaches us that what we have been doing is not working, and particularly what we have been doing in patient safety. It's the moment of truth. It's teaching us that money can't be a driver of a humanitarian occupation. It teaches us that we need to slim down and focus on what's really needed. I think this is the time when we can really turn our attention to stemming the tide of harm that comes from unnecessary treatment. Because from here on out, we're going to have more and more treatment that is desperately needed. We need to refocus our resources. We need to relearn the methods of strict infection prevention and apply them humanely, systematically. We need to learn the importance of preparation. I think that's one lesson that everyone has seen very clearly. But if we learn anything, it's that healthcare policy and government policy need to take the long view. And if we look, I think we will find that this pandemic will teach us that the voice of the patient and family is essential in care, and that many of the deaths and bad outcomes that we've had in nursing homes and healthcare facilities could have been averted if families had been with their loved ones, both to monitor treatment and to provide care and sustenance and sympathy for the people who need it.
Yeah, Helen, I agree. I think there's so many things that have gone on in the healthcare environments that we've all known about and we've all raised concerns about, especially patients and families at the bedside. And I think you're absolutely right that policy and government have to take the long view, and they have to bring patients and families to the table to help with that view. So great point. Steve Burrows, let's go to you next. What do you think the pandemic might teach us moving forward in healthcare?
Yeah, I've been thinking a lot about this, and I have spent most of my life, I wake up an optimist, I go to bed a pessimist, and then rinse, repeat, rinse, repeat. But unfortunately, this is now the afternoon, and I'm feeling a little bit, I see the whole thing really as kind of a cautionary tale. I wish I was a little more hopeful about things. I certainly am with the response from the hospitals and the care providers, the doctors and nurses, and everybody stepping up. But, and I mentioned this a little while ago, that we see it on commercials, we see it on every news program. Everybody says we're all in this together. And it's become a cliche because cliches are true. But my big concern is that there's a huge part of this country, and I have personal experience with this, that they just don't believe this thing exists. And it's deeply troubling to me. I can literally say that I'm losing sleep over this. My home state of Wisconsin is national news, whether it's the voting or whether it's the opening of the bars or whether it's this armed people with no masks at the Capitol. I can't tell you how much this troubles me because it seems like there's a whole part of this country that is paying attention and is trying to play, trying to follow the information that we have from the medical people. But there's another group of people, like there was a nurse in a bar last week that was national news. It was Aurora. And she was in the bar, and she was happy to be in the bar because she wants to drink and have a great time. And who doesn't? And even like Margo and I, just a few days ago, we have these wonderful neighbors on both sides of our house, and they're wonderful, smart people, and they wanted to have a party. And we're on lockdown here in Los Angeles. We have strict rules about social distancing, masks, and just a couple days ago, they had a party with 100 people in our front yard, right here, 20 feet from us. No masks, kids. They were having a great time. But I kept thinking about what we're talking about on these calls with all of you. And I'm just deeply concerned about how do we all learn if a whole bunch of us don't even pretend. I don't even know if they're in denial or they just don't want to deal with it. I've been working with my own family to try to inform people, and I just feel like I'm losing the battle with a lot of people, and I'm deeply concerned about how this is going to affect down the road accountability and transparency, medical errors, and Helen was exactly right. You know, this patient safety has never been more important than right now. And we really are in this together. Somebody said, the last thing I would say is one of the neighbors was justifying this huge party that happened just a couple days ago. And they said, well, you know, we're all in the same storm, but we're not in the same boat. And that sounds good. I like that. But what happens when that boat hits that storm? Your boat, you know, because this coronavirus knows no borders. You know, it doesn't matter if some of us are playing by the rules or not playing by the rules. So anyway, I wish I was a little more optimistic on that, but everybody on this, you know, on this call and everybody who's involved in this patient safety movement, I think we need each other more than ever now to keep fighting, because I think a fight is coming.
Yes, Steve, you know, you started out by saying that this is a cautionary tale, but it seems like it's a cautionary tale that keeps repeating itself historically with every pandemic. And I keep going back to Camus' The Plague that was written in the late 40s. And I'm at a point in the book right now where it basically says exactly what you just said, is that people stayed in line for a certain amount of time. And then all of a sudden they reached a point where it was like, I can't do this anymore. And they started acting out. So how much of this is human behavior, and what does that mean for the future in the next pandemic? So yeah, great point. Margo, I know you're in the same location as Steve. I would turn to you and say, boy, front lawn, 100 people, that's present, you know, that's not the future, but that could impact the future, right, of what this pandemic could do. What do you see the future being in healthcare as a result of what's going on today?
You know, I was thinking about hospital system, healthcare systems throughout the United States now, and I think they're going to be in such a rush to start the gravy train starting again, to start the money rolling in, that they're going to accept behavior that maybe 2 years ago they were starting to crack down on, but now I think the floodgates are going to open, and now that all the healthcare workers are considered heroes. I mean, somebody pointed out that the worst doctor in the world who's killed people has a sign on their lawn basically saying, thank you, you're a hero, because they're going into work. So I think the oversight's going to go away, even the minimal that there has been. And I'm sorry I'm such a downer here, but I think that mistakes are going to be even more acceptable to people. And I think it's going to make the patient safety movement even more critical and more important, because there's going to be no safeguards anymore. I feel like it's going to be the Wild West, kind of like all this reopening throughout the country has been. And I think hospitals are going to just jump in on it to get their profits up. I mean, Aurora, where my mother-in-law was at, the CEO was saying that before this, that he expected profits to increase by X billions, and I can't remember the figures right now. And now he's getting worried because the profits aren't coming in because of all the elective surgeries, so have been canceled and postponed. So I think that they're just going to open the floodgates and hope that people don't die in too great a number. So I think this is going to be a really big factor moving forward.
Yeah, you know, Margo, you raise a good point that your lens of the future is really kind of slanted by your experience with healthcare. I can hear that really in your response, because I know you to be pretty much of an optimist, maybe a cynical optimist, but an optimist nonetheless. So that's really interesting. And you know what, I'm going to hand this off to Marty, my co-host now. Marty, if you want to take it from here and ask Josh the same question.
Thanks, Tracy. Hello, Josh. We're going to now ask you for your thoughts as a recovering patient about how this pandemic is going to change the future of healthcare. I'd love to hear your perspective on that.
Thanks, Marty. Yeah, it's an interesting question. And I hear what Steve and some of the other folks who are answering this question today are saying about human behavior is complicated. I don't have a background in healthcare, but I did work in Washington, D.C. and did political organizing and kind of public policy research for about 7 years. And one of the things that stuck with me from that experience is how people only really resonate with and connect with things that affect them personally and deeply. And I think that we've seen an interesting curve. At the beginning of the crisis, everyone was a little bit frozen because it was so strange, it was so new. And now we're seeing people starting to push against the boundaries of what's recommended. We're seeing all these different camps develop. But the virus hasn't worked through the population yet. And I think that from my experience, it's such a, as a patient, or even if your family member has this virus, it can be such a destabilizing and uncertain and difficult experience that it's very visceral. You can't ignore it if it touches you or if it touches your family. But I think for a lot of the country, it hasn't touched them. And we don't respond to generalized stories the way that we do personal experiences. So I think it'll be interesting as the virus moves through the population, and particularly out of urban centers and into some of these other places, to see what happens in terms of how people respond. And I can only hope that we build a political constituency that starts to think beyond their own private healthcare situation and starts to think a little bit more about public health infrastructure, which just isn't something that enters the healthcare debate very much when I think about how much it costs to go to a doctor or what a procedure costs for me. But what I hope will happen is that more people will start understanding that we need a coherent system to deal with big, coherent pandemics.
Gosh, I'm going to ask you a follow-up question because you're one of the younger people on our panel, probably the youngest person on our panel. Do you think this is going to get people who are younger out to vote in ways that they haven't before in the United States?
Oh man, it's such an interesting question because I think that there are lots of incentives to get out to vote, but there's also a lot of fear. So it's like the fear and confusion that come with something so new, which is a very destabilizing force. But then I think also the strong feelings that come up when you're under stress and under pressure. I think that net, that more people younger people will come out to vote, because here we are trapped at home, wanting to go out, wanting any kind of expression, any kind of way of being out there and participating in the world. That's something I feel very much. And I think that a lot of young people will want to exercise their rights and have more perspective in a way that maybe they wouldn't if their lives were busier.
Pat, let me turn to you and ask you, because I know you have your hand in a lot of different networks, but how do you see this pandemic affecting the future of healthcare?
I think if we listen to and assess what worked and what didn't work, I think we'll be able to move ahead in healthcare. But again, I don't know yet if we're ready to do that. I think we should, but I'm not as confident that we will. And for example, I think that one of the things that we always talked about, data-driven, this has to be data-driven, yet it's just recently that the lights are going on, that the people that were most vulnerable, the ones in the nursing homes, assisted living, are the ones that have the highest mortality rates and are affecting the mortality rates. For example, in Illinois, it's over 50% of the patients that have died of COVID-19 are from nursing homes. They make up less than 1% of the entire population in Illinois. So we need to look at that. One set of data I'm still waiting to hear if I'm going to get access to is of those that died from nursing homes, how many were African American and how many were Latinx? Because I think that we're going to see there's some concentrations as well in those areas. So when we look at Chicago, we know that Chicago has, anywhere from, 46% to 60% of those that have COVID-19 are Black. And yet at the same time, how many of those are also from nursing homes? So again, I think we need to dig deep into this information and data, because I don't think that we have the answers. And I look to, healthcare at a national level, a state level, a regional and local level. And I think that there were plenty of opportunities to coordinate and nothing happened. And so when you have states and municipalities trying to vie for the same set of PPE, personal protective equipment, and there's no equitable way for distribution, I think that points to a major gap in how we all work together and work as one to help each other out. I think it was left up to the states, the ones that had ventilators and overabundance of ventilators, were sending it to the states that didn't have it. but that was very much state-driven. There was no national leadership at that point. That's my perspective. I think the healthcare workers, whether they were in hospitals, nursing homes, hospice, dialysis, home health, they really rose to the forefront. They stepped up and they went in knowing that it wasn't going to be the best situation for them, yet they put their lives on the line. And when you think about it, about 8%, and some people say 10%, of the people that have COVID-19 have been confirmed are healthcare workers. So again, we have other people, first responders and others, that again, there's many people that stepped up. And the one thing that I want to also emphasize is, and again, it's probably because see the world as the cup is half full, but it's the opportunity to fill it with the rest. And I think that people really, the majority of people took this to heart. We wouldn't have had the mitigation strategies that they put in place if we didn't have those mitigation strategies and people followed it. Consumers, ordinary consumers, if we hadn't had that in place, who knows what the numbers would have been. And we'll see about the second wave if we're too ambitious in relaxing those rules, if the second wave. But there is an area that didn't receive the communication well. And as much as I talk about the Blacks making up so much of the deaths in the Chicago area, it also, the Latinx have the highest rates of confirmed COVID-19 in Chicago. So are we communicating in a language that they can understand? And are we communicating at a level for the youth as well? Are we effective communicators? We seem to communicate the same way to everyone, and the messaging needs to be different. So I'm optimistic that we can overcome these, but I think it's going to take some political will to make it happen. And I do believe that the changes that we'll see going forward in healthcare, they're either going to be transformative or we're going to be doing the same old thing and getting the same old results.
Pat, a follow-up question very quickly. You talked about the importance or the possibility that there will be more political will for change. What's your hunch? Do you think the current conditions will get more people out to exercise their right to vote and to express that political will?
I am concerned about the ability to get out and vote, because there are discussions going on right now, whether it's going to be by mail, whether it's going to be in person. We have voting right, issues going on across the nation. So I am concerned that not everyone may have the opportunity to vote. And I have to say, I think voting is like the sacred right we have as Americans. And so I do hope that people do get out and vote. And I, for the first time, signed up to work with the League of Women Voters. And it's about getting people out to vote. So I'm optimistic, but I also think we've got some hurdles that, prevent people from voting. And I think we need to be focused on those as well.
Thank you, Pat. Tracy, I'm going to transfer this back to you to continue our interviews.
Thanks, Marty, and thanks, Pat. I'm always impressed by the depth of experience in all the places that everyone on this panel touches. I learn every time I speak with you, and I feel really fortunate that the viewers are going to learn from your experience and your stories as well. So thank you again. VONDA, I am going to turn to the woman who is traveling cross country during this pandemic and ask you, what do you think this is going to do to the future? How will this pandemic change the future of healthcare?
I think to look at what we might learn for the future of healthcare, we need to look at where we're teaching and where the future of healthcare learns. And that is with not just the individuals who are going through medical sciences right now, but also those who are receiving continuing education. And I would hope that what they would pay attention to in order to inform that learning is how quickly we can bring and draw our attention together on a particular issue. I think it's been quite evident that something outside of us arose very quickly, and around the world we began to focus on it. Now, we're not necessarily always aligned with what to do about that, but just the mere fact that something like that can come along and get everybody almost paying attention to the same thing is pretty remarkable. And I would hope that behavioral scientists would really inform the future of healthcare and the way in which we're teaching, as well as what we're teaching in that regard. I think also, as many of my colleagues here have mentioned, this COVID-19 has revealed a lot of cracks in the healthcare system that many of us paying attention to safety in medicine have known about. But I think it's also really eliminated a lot of myths. For example, the myth that doctors know it all, that even scientists know it all. We've been able to take a look at the way in which science emerges rather than is something. And just to be able to attend to that and to be able to track something that is new, that no one knows anything about it. And remember in those first few weeks when I was on weekly calls with many of you and many others, that we were just learning along the way. COVID was teaching us. And I think if we learn how to learn and we really put our attention into the process of learning and break this myth that there are certain people, because of certain experiences or certain education competencies, that they know it all, and especially that they know that they don't know it all, could really bode well for us as we continue to inform safety in medicine. And also the cracks around accessibility of healthcare. We know that, it's not new news, but now we actually have had a more, I think, vivid and perhaps a more pervasive experience of just what that means and why it is so critical for us to try to assure a broader access, not just here in the United States, but elsewhere. And then the last thing I would say is that for me personally, one of the things that I'm hoping that I learn and that I continue to teach forward is to really get language, that language is really important, and the way that we use words matter a lot. So for example, we talk about patient safety, but those of us in patient safety and who have been working on that for many years, we've always known that it's been broader than just the patient, that the healthcare provider and those who are supporting care need to be healthy also in order to deliver care. But we have still labeled it as patient safety. So I am hoping that one of the things we do is really go back and relook at language and how we talk about this so that our intentions match our words. Therefore, hopefully, the general public who won't care about healthcare in 5 years if we get this right, and maybe they shouldn't have to, but that our language matches it so that when we do convey something, it's conveyed quickly and promptly and it makes sense right away.
Vonda, great answer. So many pieces of what you just said resonated with me. And I think the first thing was the behavioral scientists and their take on this and what they're going to take away and what we're going to learn from them. Josh mentioned human behavior. I think Steve mentioned human behavior just by what he saw on his front lawn. And we have all the science. We have data. People argue the data. Human behavior is overriding the science right now. And that to me is really interesting. It changes daily. And I think until everybody takes an objective, beginner's mind approach and goes at this with kindness, we are going to repeat the same things, Margo, to your point. So great answer. Yeah, and great conversation.
Tim, I'm going to turn to you now. What do you believe this pandemic will teach us for the future of healthcare?
That's an excellent question, Marty. What will we learn from this pandemic? And I think from my perspective, from what I'm seeing, I think one thing that's clear as can be is it's indicated the power and the importance of empathy and compassion for all members of the care team. that we are able to communicate it as well as possible to patients and families and their loved ones, but also on the flip side, the need for empathy and compassion for those at the front line who are really delivering this kind of care. Never before have I seen the power and the importance of empathy and compassion going both ways. There's a couple of other things I think we're really going to learn from it, and this comes from my patient safety background, and that is around this notion of failure mode and effects analysis. More work could have been and should be done going forward to look at these kind of potential catastrophes. How do we look at the various failure modes, and how do we become better prepared? How do we plan better for the possibility that these, sorts of things that can happen? And finally, I think at a very granular level, I think this pandemic is really, really pointing out the importance of hand hygiene for everybody. I am seeing that more and more and more, and that's why it's just great working with the various people we do, with Armando, and his big focus on infection control and that sort of stuff. I just think it's absolutely critical. So I think for me, simply put, those are some of the biggest lessons learned, Marty, from what I'm seeing, related to this pandemic.
Thanks, Tim. I couldn't agree more with that. That connectivity that comes with empathy between providers, patients, and family members, I'm really seeing in the work I do too. Thanks, Tim.
Marty, thank you for giving me the opportunity to share some of these thoughts. I really appreciate it.
Well, you're welcome, Tim. I'm so glad you could be part of this series. Tracy, back to you.
I'm going to go to Dr. David Mayer now and see what he looks into his doctor crystal ball and predicts for the future after the pandemic.
Tracy, what do you think on Karnak? That's certainly a daunting task, but going last, I get the ability to, comment on some things, and I totally agree with Josh. We have not seen this virus hit the states that it's going to hit. When you look at the data, the states that are seeing 5 to 10% increases, North Carolina, Texas, Arizona, some of the heartland states, where they really didn't think this was a big deal. It was all East Coast, West Coast, and Illinois. So I think they haven't gotten out of their denial yet. And it gets to Steve's point and Margo's about what they're seeing in California. We're seeing it here in Arizona, where we're sort of isolating down. Is this country is so polarized. It's polarized politically, it's polarized in everything we think about and do, and it's polarized in healthcare today. You have the people who are taking this seriously and the people who believe it's still a hoax and they don't know anybody who's had the virus. So this must be some political agenda issue. I will tell you what is going to change coming out of this. We are going to see acute healthcare change dramatically. I will go and make some bold predictions. I think we see 50% of the hospitals in this country close. And I say that because I think we're going to see a generation of nurses leave the field. I don't know if you saw Becker's article today of data. They polled over 1,200 nurses and 64% said they are leaving the acute care environment or leaving healthcare totally. We've seen examples where nurses have put their badge on the desk of their managers and walked out saying, I'm not doing this anymore. And I really think we're going to have a tremendous shortage of nurses to manage the large hospitals and health systems. They want to go to the ambulatory sites. They want to work in an office where it's, quote, safer. Let me do endoscopies versus ICU, emergency department type work. So unless the government is ready to print another $1 trillion, I'm hearing large academic systems, some in US News and World Report is some of the best, saying if we see another virus, they're going to have to file bankruptcy. Healthcare is an industry, just like aviation and hotels and other things. And I really don't know if acute care is going to come out of this for at least a decade or longer. And then being somebody who's very interested in teaching and training the young generation, my God, what they're seeing, if I was a resident right now, I would look to go get my MBA. I'd look to go into research. I'd look to get a financial job with some biotech company. I would be doing anything to keep out of the acute care hospital environment today. So, I'm always an optimist, but I see some doom and gloom ahead. And again, the silos. If we don't take care of our care teams and our workers, we're not going to take care of our patients. It's not, as Vonda said, patient safety and caregiver safety, it's health safety of the workers and the patients in that. And if we don't treat them equally well and maintain their safety, we're never going to achieve goals on either side of that. So it's going to be trouble. It's going to get worse before it gets better.
So much of the success and the culture of a healthcare system depends on leadership. And, you've seen that firsthand. Do you think that there are leaders in our health systems that can prevent what you described from happening?
Yes, I think there are some examples of health systems that have been able to, for lack of a better word, prepare themselves for this sort of event. Nobody could have prepared themselves for a pandemic, but they have been able to set their health system up over the last 8 to 10 years that have aligned for instance, a distributed care network, where you don't have to have everybody come to the mothership to get treatment. 70–80% of the care is being done outside the hospital in these facilities. And now the fear of having to go to an academic medical center because you burnt your hand and now need treatment in an emergency department, if that's your only access to care, you're not going. And we're seeing this more and more. But if there are prompt cares and urgent cares and what we call big box facilities, they're hospitals without beds, where you could get that sort of treatment, people are going to those facilities. And so I think there's going to be a great growth in the ambulatory care environment, but I think we're going to see tremendous changes in the acute care, sort of tertiary care model of hospitals across the country.
I think it's been an interesting conversation, and I really come back full circle to what Helen said, is that the future of healthcare, if it's going to be done right, is going to take policymakers and government officials to take a long view. And to do that, it's going to take people from both sides of the aisle, and it's going to take a lot of kindness. I wish Rosemary Gibson was here right now to join us, because I know she's having to deal with, people from all over Washington right now to get some good policy changes made in terms of medication safety. So good stuff. We'll close it out. I'm going to hand it back to my co-host, Marty, to see if you have any closing thoughts, Marty.
Thanks, Tracy. It has been interesting, and I'm resonating really with the thought that things are going to really change from acute care to non-acute settings. I hadn't really thought about that before Dave brought it up, but with telehealth also just really happening, that's becoming easier. Some of the barriers to that are falling from waivers, from regulations, and just thinking about the television I'm watching now, and there's just a lot more advertisements from physicians on the TV right now about, call me up virtually, I can get you an antibody test, or I can treat your dermatology needs. There's just an uptick in TV already from people that are out there actually probably reaching out to the patients that are afraid to go to the hospital right now.
Thank you all so much for participating in our Finding Hope and Meaning Through Stories during the COVID-19 pandemic series.